Disclaimer: this video is for informational purposes only. Always consult with a qualified healthcare professional before starting any supplement.
Hey everyone, so are you going to meet someone where you don't know about their HIV status, or you don't know if she or he is bleeding, or he has a bad gum or ulcer in his mouth or in her mouth? And also, this video can kill your anxiety regarding getting an HIV and make your mind peaceful. I've already spoken about PrEP, which is post exposure prophylaxis, and the medicine which I've chosen is Vironil. Okay, so I've already made a video, and link is in the description in case if you want to know more about post exposure prophylaxis. So in this video I'm going to talk about pre exposure prophylaxis. So what is the difference between PrEP? I call it as pre exposure PrEP, and for post exposure I'll call it as PEP. Okay, what is the difference between PEP and PrEP? PEP is something when you get into a relationship without any protection, and you start PEP within 72 hours and you take it for 28 days, so you're free from HIV, right? So what is PrEP, which I'm going to talk up in this video? So in this video I'll be talking today about PrEP, key benefits and usage for HIV prevention. Is PrEP benefit or how to use it for oral sex? Is PrEP for good for annual sex, which we call it as demand PrEP 2:1:1? And also how to use PrEP for normal sex, and dosage and guidelines including PrEP 2:1:1. And also I'm going to talk about precautions and side effects. What happens when you miss dosage, and I'm going to give you the guidelines, and also the duration to take PrEP. And in case if you have any kidney issues or you are worried about kidney health, so I'm going to give you precaution for kidney health as well. And I'm going to talk who should not take PrEP, and also in case if you missed out your daily PrEP tablet, what is the next option available? Okay, so this all the topics I'm gonna cover and more as well. So let's talk about Tenvir EM and why this product. So basically I've choose this product is because this is a best known product in India, and it is easily available in all marketing medical stores as well. And this is cost effective. I'm going to talk about the cost as well, and this has less side effects. So this is why, and also you have many brands who actually gives PrEP tablet. I'm going to list on the screen which all brands is going to give the PrEP which who creates the PrEP medicines. Okay, you can choose any one of this, or you can choose Tenvir EM, so once daily tablet. This actually marketed by Kilpa, produced by Kilpa brand. So let's start with the first topic. What is PrEP? PrEP is pre-exposure prophylaxis. It says pre. That means you're going to plan for a date or a one night stand, or you're going to meet someone and you don't know their HIV status. So your anxiety levels will increase, right? Whether if she has HIV or not. So that is when you're getting prepared for that moment. So that is when you take PrEP. So PrEP will actually add a protection level on your body. Even though the HIV virus is entered in your body, the body will not replicate it, and the HIV virus will die, and you won't be an HIV patient. That is the reason getting advance ready in order to meet someone who you don't know. That's when you use PrEP medicines. And next topic, number 2, is key benefits of using HIV prevention. One is it will kill your anxiety, it will give you a peaceful of mind, and it has less side effects. And major benefit is PEP, you have to use it for like 28 days mandatory every day, and PrEP, which is pre-exposure, starts from 2 days. So it is best then you're taking it very less days when compared to PrEP medicine. So that is the major benefit of PrEP, and you'll have peaceful of mind when having intimacy with your partner as well. So next is PrEP useful for oral sex? My opinion is no or yes, because usually WHO does not recommend PrEP for oral sex, because oral sex, your saliva already has the enzyme to kill the virus, but still there are chances of getting HIV when she is bleeding, or when she has oral like bleeding gums, or if she has ulcer in her mouth, her or he, I'm just calling it as her, so partner's mouth. So it is difficult to know or ask someone, are you bleeding, or do you have, are you hygienic on your teeth, gums, and do you have ulcer? It's not possible, right? So in order to kill that kind of anxiety, PrEP, you can use it, so that you'll be peace of mind, or else you might get into PEP if you notice her or your partner's mouth is bleeding. So it is always suggests PrEP can be used for oral sex, but still it depends on you and the hygiene what your partner is holding. Now let's see how to use PrEP for anal sex. So anal sex is only like mainly for male to male in Indian community. I'm not sure about the outside. So PrEP for anal sex, there's something called demand PrEP, which is 2:1:1. So what is that 2:1:1? In case if you're planning to have anal sex, you need to take 2 tablets 2 to 24 hours before the sex, and post sex you need to take 1 tablet 24 hours, which is your first dose, and another tablet which is 48 hours, which is your second dose. So 24 hours after the sex, first dose, and 48 hours after the sex is a second dose. Okay, so that is, we call it as 2:1:1. So overall 4 tablet you're safe for anal sex, and this does not include for vaginal sex. Okay, vaginal sex required little more dosing, little more days. I'm going to talk about that in the next topic. So let's see how to use PrEP for vaginal sex, which is call it as a normal sex with women, okay, or your partner. It's just a normal sex, and you're not using any condom. That's the reason you're using PrEP. Okay, so in this case, so you need to take 21 days of PrEP in order to get complete protection. Just note my point. Complete protection. That does not mean you have to take 21 days mandatory, but it is for complete protection. Whatever days you take, you have to take daily, okay, for 21 days. Or if you're planning for 14 days, you need to take it for 14 days. If you're planning for 7 days, you need to take it for 7 days. So the protection level differs. So 21 days is recommended as per WHO for complete protection and peace of mind, and reduce your anxiety levels. So you got it right. So 21 days for anal sex. So let's talk next about precautions and side effects. So the precautions is common. You should be normal kidney health. Your kidney health should be normal. If you want, you can test it before you're starting PrEP. And also side effects, you'll have some kind of nausea and vomiting, and that gradually reduces once this medicine, your body start adapting this medicine. Okay, and that's just the precautions and side effects. Pregnant women, or you're using any other tablets, you need to consult the medical doctor. Okay, so before using this, you can also consult urologist and sexologist as well. So now, what in case if you miss to take PrEP medicines? So in case if you miss the timing within 12 hours, go ahead and take it. But in case if it is more than 12 hours and it cross 48 hours, then you have to restart your dosage. In case if you've planned for that weekend, then there's no other option because you're incomplete protection. Then you can just discontinue, have a peaceful of mind with your partner, and then start with PrEP medicine for 28 days, in case only if you miss PrEP more than 12 to 24 hours. Okay, so that keep the calendar, keep your alarm, and make sure you take PrEP daily. And for best result, you should be taking it every day, same time, the time you started day one of taking PrEP, and it should be continued. For example, if you eat dinner at 9 p.m, you will take it at 10 p.m, and you will continue same 10 p.m for full 7 days, 14 days, or 21 days as per your requirement. Okay, that's how you take it. And for duration, yes, it is 28 days. Sorry, not 28 days. PrEP is for 28 days. Duration starts from 2 days, which I have called as demand PrEP, and up to 21 days. Okay, so who should not take PrEP? In case if you have any kidney issues, you should not take PrEP. Take a kidney test, go to your doctor, say this is the report, can I take PrEP? And doctor says yes or no. Okay, and I've already talked about daily, how in case if you miss to take PrEP. So I'm gonna unbox this and show you how big the capsules are, and also what all the ingredients left in this. Okay, so this all the ingredients in this tablet. So most of all the brands will have the same ingredients, so it does not matter, but only thing is that this brand is best known for PrEP. Let me unbox this and show you how does it looks like. So first thing what you see is a pamphlet where you'll see all the precautions. I'm sure that you're not going to go through this because it's so small in text, and also it is, but it is better if you go through this. So this is how the PrEP tablet box looks like, and this cost, I forgot to talk about the cost. This cost around 1600 rupees, this one, which comes with 30 capsules. In case if you're using for 21 days, you have 9 other capsules left for the next time. But in case if you want to avoid this, my suggestion, I'm gonna give you at end of the video what all my talks, okay, on this. It's just my opinion. So let me unbox and show you before we start the topic. There's a good seal pack at top, and this is how the tablet looks like. And at back there is no wordings at all. It's just like a tablet, no branding at the capsules, just to maintain that privacy for you guys. Okay, so what all my takes. PrEP, yes, PrEP is good in case if you wanna enjoy with your partner with peaceful of mind, and yes, PrEP is actually better than PEP post exposure, because PEP 28 days, it's a big time to go, almost a month. And in case if you ask me whether you want to take PrEP, my suggestion might be yes or no, because it depends. In case if you're using a condom and not having much of oral sex, then you don't need to have a PrEP because you're safe using a condom. And in case if the condom breaks out, then you have a chance to start a PrEP. So PrEP, this will not work post exposure. This is pre-exposure. So in case if condom breaks, you can start with post-exposure. So that's very unlikely, because go with a good brand of condoms. So that is actually best than taking any capsules, because I'm not so I'm not so given to provide a guidance on the tablets. I'm not so likely towards it. But still, I just bought this in order to give a review about PrEP, because I've already made a video on PEP. So many people had commented, sir, it's very 28 days is too much so we need something peaceful of mind when having a time with partner. So what should I do? So that's the reason I just bought this for you guys, to show you and explain you about PrEP and its benefits and how to use it. I think I've covered all the topics about PrEP in this video. So I'm sure you're gonna, if you're gonna watch till now, please do hit that subscribe button. I'll come up with different we also have ADT, where um, post getting an HIV, what all the tablets needs to be used. I'll make a different video once I buy that medicine. So hope, take a wise choice, take a better choice, have PrEP, and have a peaceful with your partner, peaceful of mind. Avoid and kill your anxiety. Any doubts, you can just give a comment and I will reply back to you. Until then, take care. Bye.
Disclaimer: this video is for informational purposes only. Always consult with a qualified healthcare professional before starting any supplement.